Good afternoon, and welcome to the University of Michigan School of Public Health Epidemiology webinar. My name is Mary Beth Carroll, and I'm the Assistant Director of Student Affairs in the Office for Student Engagement and Practice. During this next half hour, we're going to talk about global health epidemiology, and we're going to take any questions that you have as prospective or admitted students. I'm joined today by a couple folks who are going to be able to provide their insight into any questions that you might have. I'm joined by Dr. Abram Wagner, who is a Research Assistant Professor in Epidemiology, and also a recent alum, Jessica. Before we get started, I'm going to have both of them introduce themselves, and then we'll take your questions.
Like Mary Beth said, I'm a Research Assistant Professor here in Epidemiology. If you come to the University of Michigan, I will see you in class in your second year. I teach a required course for second year MPH students. I also teach the undergrad Global Health course. A lot of my research is focused on vaccine preventable diseases and vaccination. I work predominantly in China, but also other locations like Indonesia and Central America.
Hi everyone, my name is Jessica. I'm a research area specialist here in the epidemiology department. My work allows me to travel to Ecuador and focus on different projects such as vector-borne diseases and child nutrition. Before starting my position here, I was a student in the global health track.
Yeah. Jessica, what did you major in as an undergrad and what was your background there?
Right. Before coming into the program, I had actually graduated from Michigan as well, and I studied microbiology.
Great. Awesome. Well, thank you both for joining us. As mentioned during our time together today, the goal is to answer any questions that you all have as admitted or prospective students. Please feel free to utilize the chat box to ask any questions while you're thinking of some. I guess a question that I have for both of you would be, what sets the Global Health Epidemiology Department apart from other programs?
I guess I could start. We have faculty working in a lot of different countries. I think school-wide, we have faculty working in over 70 countries. We have dozens of faculty throughout the school and even in the Department of Epidemiology, which have international projects. So we have a wide diversity of locations where we work. And I think we have a very motivated student body. I'm sure Jessica will speak a bit to that. But the other thing that I would want to plug is that we have a generous funding policy for students to do internships abroad. So we don't want students to be worried about the money issues. We want them to be worried about conducting rigorous science or doing really important programmatic work when they have their internship.
Right. As Abram mentioned, there are faculty members that are working all over the world, and those faculty members are more than eager to connect you with their collaborators and have you join in on their project.
Great. Well, it looks like we have our first question from Samantha, and she's asking, is there a way to, for example, follow a specific track within GH-EPI, such as infectious disease?
So what I would say is that in our school, we do have faculty who are predominantly focused on infectious disease issues or on chronic disease issues, but more and more we realize that there's a lot of overlap between those. So as a student, you will have opportunity to take electives, specifically in infectious diseases or in certain chronic diseases or in social epidemiology, and you can do that while remaining GHE student. It's not a formal thing, but we definitely have the courses there. What was your experience as a student here?
Right, so I'm interested in nutrition, and so while as a student here in the global health track, for my electives, I chose courses that overlapped with the nutrition department. That's how I was able to get in those courses.
Great, thank you. In terms of, I guess your experience as a student, was there a favorite class that you took?
One of my favorite classes was actually through the biostats department. It was a class that taught you how to analyze longitudinal data, and I think one of the reasons I enjoyed that class so much was because it was the number of students was pretty small, and the class required us to complete all assignments using two different statistical software packages, which I think was really beneficial for the time for then after graduation when I was looking for a job.
Very cool. And Dr. Wagner, you mentioned at the beginning some of the courses that you teach. Any that fall specifically under the GHE track that you enjoy the most, or even I guess like the layout of a class, if you could kind of talk about the specs?
Yeah, so one of the benefits of being in the GHE program is that you have a smaller cohort size. So you will be taking epidemiology courses with the rest of the MPH students admitted into our department, and there's somewhere between 70 and 90 students. But within the GHE track, that's much smaller. There's about 20 students who will be in that track, and so pretty much every semester you will have a course with these students. You'll get to know each other very well. I think we really like to infuse the program with this cohort effect. Like you like the students that you are going to be taking a lot of classes with. You might be doing some teachings with them, or maybe not. So courses that we take, we debate global health. Certainly, we talk about the important diseases, infectious disease, chronic diseases, which are happening globally. We also want to prepare students for a productive internship abroad. So we do have a course focused on preparing students for their internship experience, talking a lot about, having the right mindset in terms of humility while working abroad, like not being, or what can you do to benefit your host institution while you are doing your internship. And then, in our second year, we have additional courses which are focused on professional development and making sure that students are able to apply the skills which they're learning in their classes and in their applied internship experiences to find a job which is a good fit for them.
Very cool. There's a couple more questions here. One is, what kinds of projects have students done for their internship? Let's start with that one first.
Yeah, why don't you start, Jessica, talking about yours?
For my internship, I traveled to Ecuador to work on the pilot phase of a birth cohort study that would be looking at the environmental, or assess the environmental effects, or how the environment affects the child gut microbiome development. And so I found this internship talking to the faculty here at the school, but other people in my cohort went outside of the school, and that's how they found their internships. But as always, they had a faculty member at the school who guided them along their internship path.
Very cool.
So I can talk a bit about the students who I've mentored who've done projects abroad. So I do a lot of survey research in China. So I will put together surveys of vaccine hesitancy or vaccination uptake or experiences with vaccine preventable diseases like measles or pneumonia or things like that. And generally during the school year, I'll work on putting together those questionnaires, and students who will be working with me in the summer, they can participate in making the questionnaires if that's an interest of them. Maybe they add some questions in for things that they're particularly interested in. Last year, I had a student who was really interested in science literacy, so we added a whole set of questions on that to our survey. And then during the actual internship experience over the summer, what I did is last year I had 3 students who worked, and they did primary data collection. So they went to 40 different clinics in Shanghai, and they collected data on a few hundred parents. So I think that was a productive experience. We have a range of experiences that we can give students, kind of depending on your linguistic background and what you want to do. We can have students do primary data collection. We can also have students work on secondary data analyses, like maybe the host institution already has this really rich data set, but maybe they're kind of lacking some statistical expertise. Our students come in with 2 biostatistics courses, with their epidemiology courses. They can help analyze some data for the institution and maybe put together some technical recommendations or something like that. So there's really a range of experiences, and we offer a lot of flexibility for students to do things which are interesting for them.
Very cool. Do both of you have a sense that most internships include community partners, or what are your thoughts on that?
So I will say that, well, first off, you obviously need to have some sort of foreign collaborator, some sort of host institution. A lot of people are from universities. I think in academia, we just naturally have those relationships with other people, with other academic units. But for me, I work a lot with, for instance, the Shanghai CDC, so a governmental organization. I do know people who've had very productive relationships or productive internships at hospitals, as well as different NGOs. So we do have a wide range of institutions which people can do their internships at. Do you have any other examples of?
No, for my internship, we worked closely with Ecuador's Ministry of Health, and we worked on a day-to-day basis. We worked with hospital staff, and of course our university collaborators as well.
But I mean, in any internship, we want it to be beneficial to the community.
Right.
I think the community part is really important. If you're doing a research study, we'll want you to have some ethical review committee from the local institution review things, and just to make sure that there is an added benefit to the local community, especially since you might be working in these resource limited settings. So we don't want the students to be like a burden on the population, but we make sure we have classes that prepare you for this, and we have a whole procedure in place for that.
Yeah, I think you bring up a really good point. Can you expand a little bit more in terms of the preparation and those classes that students take before they go abroad?
So it really is dependent on the project, how much preparation you need to do outside of classes. But and I know Jessica will be able to speak a bit more to this, but there are classes where you will talk about what your prospective internship will be. You will develop a proposal that you will submit to the Ethical Review Committee, the IRB here at the University of Michigan. So that's helpful. We also have lots of funding workshops. We have funding here in the School of Public Health, but there's also funding from other institutes at the University of Michigan. So we want students to be applying to for a variety of grants, and I think they've been pretty successful at that. What was your specific experience?
So these classes that prepare you, right, in terms of the IRB and ethical paperwork or courses that need to be completed, those classes also touch on cultural humility and how to prepare yourself for traveling abroad to a country that you probably have not visited before, and especially if there is a language barrier, how to navigate that as well. And aside from that, there are also workshops that touch on the same things, and also there are people who, for this internship, it's their first time leaving the country, so there are practical tips on what to bring, how to prepare, what to do once you get to your host country, how to find accommodation, things like that.
Oh, great. Very cool. We have a bunch of questions coming in, so thank you so much for your engagement if you're logged in. One question that I wanted to address in regards to if we're still accepting applications for fall 2020, and the answer is yes, that we are. So please feel free to email us at SPH Inquiries if you have questions about that, or if you have specific questions about the application process, feel free to ask those in the chat box. I will say, though, that our applications for international students, the hard deadline did pass, and that was January 15th. But if you are a domestic student and you're interested in the NPH program, please feel free to contact us, as I mentioned. Another question here about funding. Could you guys talk a little bit about any research opportunities, graduate assistantships, any information that might be applicable in that area?
I could start off by talking about the range of funding opportunities which are available, and then maybe just talk about what are some examples that she and her fellow students have used. So there are hourly positions, we call those research assistantships, and I would say that a lot of faculty are looking for students to help with that. I will always have a couple of students each year who I hire for these hourly positions. But those are hourly jobs. You probably would work between 5 and 15 hours a week, and that'd be kind of negotiated between you and your advisor. But there's a lot of flexibility with those, with the hours. Obviously, maybe in some weeks you have a lot more coursework, so you work less. Maybe other weeks you can work more. So that's one set of things. We also have graduate student instructor positions. Those are GSI positions. And so those are students who would help an instructor teach a course. Students for that would get stipend and then also would get their tuition reimbursed. However, there are fewer positions available for MPH students to get GSI positions. But sometimes especially in these large undergraduate courses for biology, for psychology, they might be hiring MPH students to have as a GSI. So that is one opportunity. But in general, we hire students on for these hourly positions as research assistants.
And these hourly positions are not only limited to the department or to the school, they're available all across campus, which is really great, especially if you're interested in doing some interdisciplinary work. For example, I had a position here in the epi department, but also in the health education, health behavior department, and that was a great experience for me. And in terms of the internship, there are lots of funding opportunities both within the school but also across campus. In the school, you have the Office of Global Public Health, but across campus, you have places like the International Institute.
Very cool. Thank you. In terms of, I guess, you just mentioned a little bit about, your experiences, and we haven't really talked a lot about like life outside of the classroom and things like that. Would you be able to talk about maybe some of the organizations that you're involved in, either at the school or in the Ann Arbor community? And for you too, Dr. Wagner, I think it would be helpful for students to kind of get a little bit of a sense of what that's like.
While I was a student here, I was involved in La Casa, which is a student organization housed here at the School of Public Health. And it focuses on public health, but with a focus on the Latinx community. Outside of the school, I was also involved in a cultural group called Shinaburo, which is a musical group.
Oh, cool.
And outside of the university, there are always things to do and groups to join in Ann Arbor.
Yeah, Ann Arbor is a great city to be living in. It's this nice college town, but we have a wonderful downtown area. I would really recommend students to take advantage of the cultural experiences that they can have in the Ann Arbor area. The University Musical Society puts on a lot of different performances, musicals, events throughout the year, and they're all really, really great. So that's definitely something that I would put a plug into. Mm-hmm. Also, we have a huge network of international institutes. I work a lot with the Chinese Center, but there's also a Center for Southeast Asian Studies. There's one for South Asia, for Africa, and they put on a lot of different cultural events. And it's also an opportunity to network with other students and other faculty members, even outside of the School of Public Health, who might have an interest in the area that you are, your geographical area of interest.
Very cool. For those who are logged in who might be prospective students, what advice do you guys have for them?
My recommendation is really take advantage of your 2 years that you would have here at the University of Michigan. Go to these extracurricular events. Certainly study hard, but when you graduate from this program, in 5-10 years, no one's going to remember what your grades are. Mm-hmm. So, I'm a teacher, so when you take my class, try really hard in it. But in general, we have very rigorous classes. We have a very robust program. We'll make sure that you learn what you need to know to be an effective researcher or somebody who works in the space of global health. But really take advantage of your time here just to, have fun with your fellow classmates and to learn more about things which you don't necessarily get within the classroom setting.
Right, I would definitely say take advantage of the resources you have. The faculty here are all more than willing to work with you to find some way to learn more about what you're interested in. The career center here is wonderful when it comes to trying to that job search and during the second year or even before then. And we have wonderful student service coordinators here who will help you all along the way throughout your 2 years and especially during your internship.
I would really put a plug for our student services representatives. Our one here in the Department of Epidemiology, Elvira, she's wonderful. She's somebody who you will meet and be able to talk to a lot. Mm-hmm. We do have a very strong program for psychological and mental health services. We have an embedded counselor here in our School of Public Health, but we also have a large center on campus. So as a student, it's not all fun and games. You will have a lot of stress, and especially for people who have internships abroad, it can be psychologically taxing. And so I would definitely put a plug into those services as well. The last thing, really, like Jessica was saying, take advantage of your professors. We love to talk with students. I feed off of the enthusiasm that students have. Sometimes when I'm having a long day just working on analyses or working on papers, just having a fresh face come into my office and have such enthusiasm for a project, that can be really, really great. And I think the students bring a lot of that here. So talk to your professors as much as possible. Use those office hours.
Yeah, and all of our students are assigned a faculty advisor. Do either of you want to add anything about that?
So we do recommend that you talk with your faculty advisor at least once a semester, generally around the time that you will be preparing for classes for the upcoming semester. But you'll meet with them before starting the semester, late in August, early September of this year. And they're a great contact if you ever have questions about what courses you should be taking. Also, they're great for being a starting point for looking for international experiences. And then also, if you're really interested in those hourly research assistantships, they're also a great resource to kind of connect you with, maybe they themselves are hiring, or they know of other people who are kind of in your research who are looking to hire graduate students.
Right. And prior to beginning your first year, the department will try to pair you up with a faculty member who shares the same interests as you do. So if you're interested in the social determinants of health, there is probably going to be a faculty member who is working on that. And so they will try to pair you up. And like Abram said, the faculty members here will help you all along the way. They have been in the department for a long time, and so they know the ins and outs.
Yeah, perfect. We have just about 5 minutes left, so if you do have questions, please feel free to put them in the chat box. In addition to that, I did put a couple contacts for after today if you still have questions. One of them is Nancy Francis, who is one of the program coordinators in the epidemiology department. As mentioned, they are great resources, so don't hesitate to reach out to them. In addition, if you have more admissions-related questions, you can email us at sph.inquiries@umich.edu, and I put that in the chat box. So again, please don't hesitate to reach out. I guess as we kind of wrap things up here, a question that I have for both of you would be, what do you like best about the Global Health Epidemiology?
Great, lots of great things. I think one of the things I most enjoy is how open everyone is about talking about their research, right? If you're interested in something, people will invite you over. They want to talk with you. They want to get to know you more. They want to see what your research interests are. And there is just such a high level of enthusiasm for the work that's being done. And I think that's one of the greatest things.
Yeah, I will say that the Global Health faculty are very approachable. Being a junior faculty myself, I enjoy chatting with my other faculty members. We're always interested in each other's research. So I think we have a pretty good idea of what other people are doing what other people in the department are doing and what people throughout the school are doing. So really, I think even though we have a very large school, we have lots of faculty members in epidemiology, and you might have some sort of internship mentor who's not in our department but is in another department in our school. Even though we have a large faculty, it's small in the sense that I think we know each other pretty well.
Great. So we're closing out today's session. Anything else that we haven't talked about that you guys want to add about Global Health, Epi?
I would just mention that, again, we have a great set of students that we try to admit into the program every year. We really have been retooling our courses over time. So even between when Jessica was a student to now, we've been continually improving our courses. So we really want this to be a student-focused experience. We want it to be one where you can really come out of our program having fulfilled certain competencies. We want you to be able to successfully work in a foreign country, we want you to have some cultural humility. And of course, we have a really strong set of courses with epidemiology and biostatistics. So we have you covered for a wide range of career options.
Anything else you want to add?
No, just that the Global Health Epi track, like Abram was saying, really does prepare you for life after graduation, and that the staff and faculty here are very supportive.
Great. Well, thanks to you both for joining us today. And as mentioned, if you have additional questions, please don't hesitate to reach out. Thank you so much for coming, and we hope to connect with you in the future.